Five on Your Side has partnered with Washington University infectious disease physicians at Barnes-Jewish Hospital to help answer your questions you have about coronavirus. And joining us now, as always, is Dr. Jason Newland, an infectious disease specialist at Washington University and St. Louis Children's Hospital. Dr. Newland, let's get right to viewer questions. This one, what do you recommend for parents regarding team sports for our children? We have a daughter who plays soccer and a son who plays baseball.
I think it's time for your son and daughter to go back and play sports. You should know that a group of us from SSM, Mercy, and myself, BJC, and WashU have worked together to develop the guidances for teams and sports for youth. And these guidances says, hey, June 15th is the time we can start. And with that, we're going to do some major practices that allows for social distancing, health screening, meaning we check if someone's sick before they come, as well as ample opportunity to wash hands. So the things for you to remember, and really a culture change for all of us, is we're not going to send our child sick to their sports activities. Even though we want them to practice and get better, we're not going to do that. They're going to get screened to make sure they don't have symptoms, and they're going to wear masks probably as they're waiting to get the screening, but they're not going to wear masks when they're participating. So you should be rest assured that these sports youth organizations we've been working with have put things in place to keep your child safe as well as you safe. And lastly, it is a risk, but I think we have to start doing things for our children as they have probably had the most impact from not being able to do things. And this is the start. I think it's definitely time to do that.
Dr. Newland, our next question, since gyms are reopening, do we know if the virus can be transmitted through sweat?
You're not going to get the virus from sweat. You're going to get the virus from being around somebody at the gym, kind of a prolonged exposure, because the virus is going to come from the respiratory droplets. So when they're breathing or coughing. So if you're running next to somebody right on the treadmill within a couple of feet and that person has a virus, so no symptoms, and you're not wearing a mask, they're not wearing a mask, you could get the virus. So what do you do when you go to the gym? Because by the way, we all need to start going to the gym, right? We missed the gym. We need to practice social distancing at the gym. They're going to put that in place so you can do that. Number two, wipe down the equipment before you get on, wipe down the equipment after you're on with the approved products, and wash your hands. And number three, you can wear a mask in between things that you're doing. Now, when you're exerting yourself, maybe you're not wearing the mask. And if we do these things, we can have the gyms open and we can participate at the gym.
Our next question, Dr. Newland, now that summer weather has arrived, the mosquitoes are out. Can you get coronavirus from mosquitoes?
You're not going to get the coronavirus from mosquitoes. We're getting the coronavirus from each other, and we're going to get it from being next to somebody in close contact without masks on. And by the way, we're learning more and more at how impactful and how preventative wearing a mask, if both persons are wearing the mask, to prevent the transmission. So we wear the mask or we social distance, we wash our hands, because high touch surfaces, if you touch your face after touching that, can happen. So if we do those things, that's how we're going to prevent from getting the virus.
Someone wants to know if people have been putting off seeing the doctor for various procedures like a knee replacement, is it okay to move forward now?
It is okay to go have your knee replacement or do some of these things that you've been waiting on. The hospitals have put a lot of things in place to protect you and protect their staff. Many of the hospitals have put into place testing prior to having the procedure. So these things are definitely there. The thing you have to remember is you're not going to go to the doctor if you're for one of these type of procedures. If you're sick, you would let them know, says, hey, maybe this isn't the time, but when you're well, these elective procedures definitely can happen.
Here's a question from one of our viewers. Do we know yet if the virus will exhibit seasonality like the flu? Will recent spikes go down because of warmer weather?
We don't know about the seasonality of the SARS-CoV-2 virus, or this virus that caused the COVID-19 illness, and if it has seasonality. What we do know is that its cousins, so these other coronaviruses that cause colds, do have a seasonality that seem to be more obvious to occur in the winter. Now, is it going to go down because of the summer? I would say no. It's been pretty warm out. We're still seeing cases, and we're seeing other parts of the country having spikes in cases. So I don't think we're going to rely on it going away because it's warm out. And what I would say is we still do our practices. Social distancing, washing our hands, wearing our mask when we can't social distance, and wiping down high-touch surfaces. That's how we're going to prevent us from getting SARS-CoV-2 or COVID-19.
Dr. Newland, as always, thank you. If you have a question for the doctor, text us at 314-444-5125. That's 314-444-5125.